Participants, let's start. Good evening, everyone. I welcome you all to today's orientation session. This is going to be a detailed orientation session regarding the clinical MRCPCH clinical exam. Let me introduce myself. Just let me know that if my voice is clear. So, um, I'm Dr. Iqra. I'm one of the mentors of MRCPCH clinical exam. I have been with the MedPrep Online for more than a year now. I have done my FCPS Pediatrics and MRCPCH. I completed my MRCPCH in September 2023. Currently, I'm working as Senior Registrar at University of Child Health Sciences, Lahore. And I have an experience of teaching for like around 2 years now. The main aim of our today's session is to um, tell you about each and everything about clinical exam. A lot of questions. I have kept a lot of like frequently asked questions. I intend to answer all of those. I intend to answer any query that the participants have. So this is not like a teaching session or something. This is going to be an open interactive session. So any one of you who has any kind of questions, any confusion, please feel free to post that in the chat box, and I'll just like keep on answering them as we go through the session. I believe that most of you who have joined have already completed their and already passed their written exams. So congratulations to all of you that you have done the theory part, and now that you are in the preparation of the clinicals. So lots and lots of wishes for you. For those, if any one of you is here who is still on the writtens, then it's a good time. It's always a good idea to have an idea of the clinical exams so that you are able to prepare that and you're able to prepare your mind. As we go through, we'll be discussing the pattern of the exam, how to apply, what are the passing criterias, and I'll like by the end, I will be telling you about our course that we have designed and our success stories as well. So starting with the most commonly asked questions regarding MRCPCH clinical part. So who is eligible for this clinical exam? Anyone who has given all the three parts of the theory, the FOP, TAS, and AKP, and they have passed all of that, they are eligible to appear in the clinical exam. Some of the people are confused that is it necessary to have done to be in pediatrics and have like clinical experience to get the exam done. So on the RCPCH website, basically they say that it's preferable that you have at least like 2.5 years of experience in the pediatrics. Why? Because when you are interacting with the patients, obviously if you have done things in your journal routine and you are more you're like more comfortable with the patients, that's going to be benefit you, and that's going to be give you a better chance of passing the exam. However, obviously you can give the exam even if you do not have a lot of practice with the and a lot of experience in the pediatrics. Then a lot of people have an idea of the criteria of getting a seat, because there must be some of you who have given their exams in 2024 and they are still unable to get a seat. So basically, what you need to know is that there are a lot of candidates. A lot of candidates are now giving the exams. There's the written exams. So the written exams are like given. There's no limit of that. You can, like, a lot of people can give the written exams at one time. The clinical exams, however, because it's a very structured, it takes a lot of effort, it has to be a very standardized exam, so they take like a certain number of candidates in each exam day. So clinical exam, basically it happens 3 times a year, as in the AKP FOP TAS, all of the exams. So diet 1, diet 2, diet 3. um in every diet there are the exam happens in different stations. UK has a number of stations. Then there are stations like the clinical stations. They are in Egypt, UAE, Saudi, Oman, and then you in the Asian countries you have like Pakistan, India, Sri Lanka, Singapore, Malaysia. All of these are there. So it depends upon, in some countries there are 2 centers, in some countries there's only 1 center. So what happens is that at one point the number of candidates in the exam is 12. So 12 people can give exam at one time, and the exam happens twice a day. So basically in one whole day, they can take exam of 24 candidates. And if the exam is going on for 2 days, so there will be 48 seats. So they have limited number of seats for the clinical exams. And that's why the criteria that they give is basically like if you ask in the UK, so then if you are applying to the UK exam, so in the UK, the people who have done the AK, the written exams and their eligibility, their 7-year period is coming to an end. So they will be given preference. Then those who are working in UK, they are given preference. Then those who are not working but they're residing in UK, they are given preference. And then the outsiders are given preference. Similarly, in all the other stations, it basically depends on when have you given your written exams, and according to that, you are like more eligible to getting the seat. So basically, the thing is that you know that each exam in the MRCPCH, you have like 6 attempts for each exam. Regarding the clinicals, there's a period of 7 years in which you have to pass your exam. And that 7-year period starts when you give your last and you pass your last theory exam. So like consider that if you have passed your AKPE in September 2024, so your 7-year period would start from then, and then the next 7 years you have to get your clinicals done. So most of people definitely are able to pass through it. Getting the seat depends on the number of candidates in your area, number of stations in your area, and how do you want to apply. Like if I give you the example of Pakistan, so in Pakistan, roughly because the exam has started for the last 2 years, so the exam happens 2 times in a year, and each time the exam takes place for 2 days. So there are 48 seats for at one point of time. So obviously, the people who have passed their exams in maybe 2021, 2020, they would be given preference rather than those who have passed the exam very recently. But you never know. It's always a good idea to apply. So waiting time kind of varies from center to center. In UK, people have got seats within their first year of passing, because just yesterday we have got results of our candidates who have got this seat within a year's time, and they've passed. In the other centers, usually the waiting period is around 1.5 to at times probably 2 years as well, right? Okay, so someone has messaged in the group that, okay, yeah, I'm coming to the questions. Okay, so the question that someone has asked is that I wanted to ask how important is the English language proficiency in the MRCPCH? Does it significantly impact performance or scoring, especially in Pakistan? Okay, so one thing that you have to realize is that knowing English is important. Why? Because you are giving exam for the membership of the Royal College, which is basically in the UK. So obviously they consider that if you're getting the membership of the Royal College, you are enough, like your language, and you know enough English that you are able to communicate with the patients, because obviously after that you get the GMC and you're eligible to get work in UK. So they want to know that you have like enough understanding of the English language. However, it does not mean that you need to have a very like accent, like a very specific accent, or very, like as you say, that very hi-fi kind of language is not needed. If you have a good basic English, that you are able to communicate with the patient, you are able to understand the patient things. If you are able to understand what the examiner is asking you, and you are able to communicate your feelings, your knowledge, and you are able to do that, that is good enough, right? It depends a lot, because you see, everyone have different type way of speaking. So being Asians, a lot of Asians have a way of speaking things very quickly. However, a lot of Arabs, they kind of a bit like they speak slowly and they kind of struggle. Then we have some other nationalities, like they who have different language, so their English speaking accent is different as well. So it does not really depend that you are speaking English in a very British accent, in a very fluent way. If you have the basic kind of English communication, that would be good enough, because obviously this is exam that need to go for. If you're talking about the Pakistan specifically, obviously the exam, wherever the exam is being taken, there are few local examiners, and then there are examiners who are coming from the UK as well, and from the other nationalities as well, from the Egypt or somewhere else, they can come here. So obviously the mode of communication throughout is English. With the patients, when you are interacting in the clinical stations, if you're asking specifically for that, so wherever you are, if you're giving exam in any of the stations in which the patient does not know English, like in in like India, Pakistan, Sri Lanka, anywhere where the patient does not know English, it's okay that you communicate with the patient in a little bit of Urdu, or a little bit of your native language, whatever is it, because that you just have to give the command. The examiner is watching you. The examiner is going to take your viva, all of that in English. Just for the communication part with the patient, you can use your native language. Okay, so we have another question from Dr. Maria. She's from Bangladesh, and she said there's no center in our country. How much wage is usually common, and which center is preferred from a country with no native center? Okay, so Dr. Maria, there are two things that you have to keep in mind if you do not have in that one. People who do not have the exam centers, their first choice is UK, because in UK there are a lot of centers and the exam happens at many places at a time, so they have a lot of spaces. So if you have given exams for maybe like 1 to 2 years back, if you apply once or twice maybe, you will be able to get a seat. But then you have to keep in the mind the issues of getting the visas, of going there and managing your stuff, right? So if you are okay with that, going to UK and managing things, then we have a lot of people from who have gone, like who have got the seats being remaining in the countries where the center was not present, right? So the first preference always remains UK, because they have the maximum number. If not, if you want to go around like in some closer areas, then definitely there are people who do get seats in the other. It basically depends on what are you comfortable with. So we have candidates who were from Pakistan and they could not get a seat here, so they have given exams in the Singapore. So Singapore is a good option. Then we have candidates from Pakistan who have given exam in Sri Lanka. That's a good option as well. So it basically depends on when have you given your written exams. So obviously, if you want to apply in your like close by areas, you can definitely go for maybe India center, maybe Pakistan center, or Singapore, Malaysia. They're good centers as well. Okay, yes. Dr. Farheen, you've asked about the sponsor. We're coming to that. Okay, so I hope it's clear that how do we get the seat? How many times can I apply for the exam? As I already told you that you can give the exams. Each exam part can be given 6 times. The thing is that there's a certain criteria that I'm going to tell you that if you get a very low score in the clinical exam, then you might not be able to apply for the very next exam. You have to wait. But if you have if you haven't passed one exam, you can definitely apply for the next exam. About the sponsor, a lot of people are very confused about this word, because obviously sponsorship means that someone is going to maybe pay for you or someone is going to take care of you. It is nothing like that. Sponsor just means that you have to give a reference of any person that you have worked with. That's it, right? So it could be any of your colleagues, it could be any of your seniors. It's preferable that if you know someone in your workplace, who the person who has given MRCPCH exams and they're registered with they have GMC, or they're registered with the Royal College, it's a good option. Because in the sponsors, like, they are going to just ask the name of the person, the email ID. They might ask that, they might email that person an idea that have balances or something like that. Is just a reference, someone, a senior, a colleague who you know and who you have worked with, who can just put a who can put forward a good word for you if needed, right? So it could be any of your colleagues. I hope your answer is clear, Dr. Faheen. Let me know if you want to know more about the sponsor thing, right? Okay, so how to book the clinical exam? Again, this is something, if you haven't because the seats are taken in like within a minute or so. But this is not like that. In this, booking window for each center opens for like 2 to 3 days. Like suppose the exam in the UK, so the booking window is opening on maybe Monday, so it will remain open for Monday, Tuesday, Wednesday for 3 days probably. Just a second, I'm just looking at the questions. Sorry, is my voice not clear? Is it clear now? Okay, let me just check my connection. Okay, yeah. So I really apologize. I understand that at times there are some signal issues. So I'll try to get that over. I'll try to overcome that, and I hope that doesn't happen again. Yeah. So I was discussing that how to book. Yeah. Again, someone is saying that there is no voice. Let me just see if I can. Okay. So are you guys able to hear me now?
Voice is clear.
It's still breaking.
No.
Okay, so I'll try. Yeah, thank you so much, Dr. Swapna, for responding. I apologize if it happens again. Just let me know, and I'll try to change the connection again. Okay, so I was telling you how to book the clinical exam. So the thing is that booking the clinical exam, as I told you, that it's different from the written exams. So the booking window opens for 2 to 3, like roughly 3 days. And in those 3 days, you just have like you log in into your account. You have already passed your written exams. There will be an option that you are eligible to do the booking for the clinicals, and you are going to apply for that. This is not a confirmation. This is just an application that you have put forward. You can put forward the application on the day 1, on the day 2, or on the day 3, whatever you feel like, right? So after your application of for the exam has been submitted, it's going to take at least 4 to 5 to at times 4 to 6 weeks. After 4 to 6 weeks, you are going to get an email in which they will tell you that you have got the seat, or you haven't got the seat in that specific exam. This again depends, as I already told you criteria before, that this depends on when did you give your written exams, where are you residing, is there a center in your area. So whatever the criteria according to them is, if you are eligible and if you meet their criteria of the seats, you will be getting an email after like maybe 4 to 6 weeks, and you will have the confirmation. Then in that email, you will have a payment link. And after that, like you receive that payment link, you are going to confirm that you're going to pay on that. You have at least, I think, 4 to 5 working days to get the payment done. If you get your payment done in those 4 to 5 weeks, the time period, the window that they have given, then your seat is confirmed, and they will message you that your seat is confirmed. Then closer to the exam, like around maybe 4 to 5 weeks before the exam, you're going to get your final exam card, like your entry card. It's a paper in which it will be shown that what is the center and what time have you got the seat. It could be like, is it a day exam, is it a night exam, evening exam, or whatever the details are, right? So it doesn't, so that basically your job is to have an idea of when the booking window is open and apply in that window, and then wait for it and keep preparing. One thing that you need to be clear is that you cannot apply for more than one centers at one time. Because you see, all the exams of the clinicals, they are not happening on the same date. Like the exams in UK, if you like just log on to the RCPCH website and see, so the exams in the UK, they start early, like they will be starting probably in September, and then there will be exams in the center would be maybe in October or something. So the exams go on for a quite a number of like weeks. So, and the booking window are at different times as well. So if you have applied for one specific station, right? Like suppose the UK window opened and you thought that, okay, I want to apply for UK. So you applied in UK, and later on and you haven't just got a response from them in next 4 to 5 weeks, and the booking window for maybe your own area, like maybe Pakistan, has opened, and you want to apply for the Pakistan as well, you would not be able to do that, right? Unless you get the rejection from the first center that you applied, you will not be able to apply for a second center. So be very careful in applying, because we have had people here, like some colleagues who thought that they would not get seat in Pakistan, and they applied, I think, in some other area. And at the end, they did not get a seat there, and they were not able to apply here because of the booking issues. So just like be careful about that, and be prepared that in what center you want to apply, and just apply for that very center when the booking window opens, right? Okay, so any questions so far? Anyone wants to like open mic or tell me, ask a question, they can do that as well. Okay. So this is roughly the fee structure that is going on. You can see that the fees are in pounds, and it is different from different areas. So you can, whatever center you are going to, you're going to be apply according to that. They have their own like own whatever they have, like estimates according to which the exam fees are different at different areas, right? So this is the fee structure for 2025. Okay. Sorry, Dr. Priya, which criteria are you asking about? If you can ask again. For getting the seat. Okay. So the criteria for getting the seat, you can go to the RCPCH website and read that as well. I'll tell you that the criteria depends if you are applying in the UK. So the criteria depends the people who are working in UK, and they have their exam given maybe 4 to 5 years back, and the 7 year period is really coming to an end. So they will be given the first preference. After that, people who are doing the jobs, and it is important for them to give the exam to get to the next level of the residency, they will be given the preference. After that, on the third, probably the candidates who are maybe not working in the UK, but they are living in the UK, they will be given the preference. After that, the preference will be given to the outsiders, and those people who do not have the centers in their own countries, like maybe Bangladesh or any other area where they do not have the center. And then the people who have centers in their own areas but they're not getting the seat, they will be given the preference. Similarly, in any other station, basically the criteria depends on when have you cleared your written exams. The more the time passes from your written exams, there are more chances are there that you will get the seat in the first go. Dr. Maria is asking, would you recommend DCH UK before MRCPCH clinical? Does it improve the chance of passing? I don't think that you need that. I do not have a lot of people around me who have gone through this path. It's just an added degree. If you want that, it's your choice. But it does not really, obviously, it will give you an exposure to the exam, and it might give you a better exposure, a better practice values, but it's not necessary, and it does not signify basically that it's going to increase your rate of passing, because a lot of candidates I know that who have just given their returns, their clinicals in the first attempts, and they've gone through them with the flying colors, right? So it's not really basically a criteria or a necessity. Dr. Safura is asking, people on MTI route get higher preference. Yes, because obviously if you are have gone and you are working in UK and you are on the MTI program, so yeah, there are higher chances that you will get the seat compared to those who are outside the UK. Okay, so most of you, if you are preparing for the clinical exams, you must know this circuit. But like just have a quick idea of how this exam goes. So this exam, basically clinical, has 10 stations. So you can see the name of the station. This starts from station 1. So station 1, 2, 3, and 4. These are your clinical stations. They are at like, which are also called short cases in the other exams as well. So clinical stations mean that the patients will be there, the real patients would be there. You would do the short case examination on the patient. Their stations are like CVS, respiratory, abdominal, neurological. Then the other stations include the MSK or a lot of other like the GP, etc. as well. So the each station is of 9 minutes, right? After that, station 5 is development station, right? So development station, it's a big station. It's of 22 minutes, and the history station. These two are the major chunk, your main stations, which are of 22 minutes each. And so you see they're written two, which means there are two development stations going on at one time and two history stations going on at one time. But both of those history or the development stations, they have the same scenarios, right? After that, you have communication A and B, two communications, which are again of 9 minutes, and video A and B, which are again of 9 minutes. So basically, this makes all of this 10 stations. How do you start with the stations? So basically, if you are roll number one, so on one specific day, 12 candidates are giving the exam in one circuit, right? Because you see, development stations are two, history stations are two. So at a time, 12 people are giving the exams. So roll number one, whoever is first in that very batch is going to go to station one. Roll number two is going here. Roll number three is going here. Roll number four is going here. Roll number five and six are going here. Roll number seven and eight are going here. Then 9, 10, 11, and 12, right? So this is how it works. And if you like, suppose if you are roll number 4, you'll be starting a station here. Then it's not that you're going to complete all the clinical stations first. You are going to go in this circuit. You will do your development, history, communications, videos, and then you're going to come your clinical, and then your circuit is going to end. So the circuit moves in one. That's why we call it a circuit, right? So it moves in one direction, and you do this. The exam is very well organized. It is not like that there's a big hall or something. It happens in areas where each station has their own room. You have the waiting time because each station has like 3 minutes in between. Then you have the waiting time. So you sit outside, you relax, or if you get any of the information outside, you read that. And then each station is in a separate room, which is like isolated, and you are very comfortable in giving the exams, right? So basically, at times there could be a bit of, people are like those who have not have gone through any of the mocks, so they have not gone through an example. They feel that how will we understand? So everything is managed like really, really well, and you are guided very well about the exams. And you are taken like from one station to another, and everything goes on in a very sequence. So total time roughly takes around like 2 hours 45 minutes, around 3 hours, like it takes a standard time. Okay, so this is basically your score sheet. As I told you that there are 10 stations. Each station, your clinical one has 8, like total marks is like 8. All your clinical stations had 8 marks each. Your development is the largest numbering, like the maximum number station is your development station, which has 12 marks. History station is 10 marks. Then communication A and B, they both are of 8 marks, and the video stations are of 8 marks. So total of these marks, this makes 82 marks, right? And your passing criteria is, this is the score, like you will get it. Like in the clinical station, you can have this mark. So this is how you are scored, and this is how your score is being done with each station. And the passing marks for this is 62. Yeah, so basically the total exam score is 82, and the passing marks is 62, right? And this is basically someone's like mark sheet, the way you are marked when you get your result. So there will be a result. You will get a detailed review of what have you gained, how have you scored all those marks, and you will have all that in your detailed mark sheet. So 62 is the passing mark. If by chance you are unlucky and you are unable to pass, but you get the score between 52 to 62, right? It's below 62 but 52 to 61, then you are eligible to that you can apply in the very next exam, right? But if you had very bad luck and some stations went really bad and you scored less than 52 in your exam, they consider it that if your score is so low that it is less than 52, you probably need some more preparation. So if the score is less than 52, will not be eligible to apply in the very next exam. Like, so suppose if you have applied in the diet 1 exam and your score was maybe 50, you will not be able to apply in the diet 2. You will have to skip the next diet, and then you can appear maybe in the diet 3, right? So this is how it goes. If you have marks between 52 to 62, 61, like you will be able to like apply for the next one. A little bit of how this exam works. As I told you that it is a very well structured exam. A lot of people have confusions about how it is scored. They obviously they have apprehensions that the examiners do not mark well. So each examiner, they are prepared well. They have their trainings before becoming examiners. They're taught well. The stations are discussed before. They decide that what are the critical points, what is the right point that we are going to mark, what is the absolute point that like if the exam, the candidate doesn't do, we cannot pass or something like that. So it is not like something that they are doing it on the bias. They have a very set standard criteria, and they have standardized mark sheets. So they are available on the RCPCH websites as well. You can download them. You can have a look that each mark sheet, it has different domains. Each station has a different mark sheet, and on that it is written that what are you marked for. There's separate marks for the communication. There's separate marks for the like of examination, for the differentials, for everything, for the management and planning. So you are not assessed as a whole. So it is not like that if the clinical station is of 8 marks, so the examiner is going to give you 5 out of 8 randomly, because they think that your performance was average. They have to mark it properly on the mark sheet that what are have they assessed. If they have not, if like you see, when you see a mark sheet, so there are 3 columns in that. Either it's like the patient, the person is really good, so they will give you the marks like 2 marks, or like in the first column they will mark you. If they mark you in the second or the third column, which is like partial or like they're giving like no mark in that, they have to give an so basically I can make you understand with this. So basically, in like the meet standard, borderline, and the below standard. So similarly, these columns are being marked on your mark sheets as well, right? So if you do well in certain domain, they are going to select the meet standard. But if they select the borderline, or if they select the below standard, they have to write it down on the comment box below the mark sheet that why have they given it? Why do they think that the person was not meeting the standard? So basically, what it's written here, all of these are the skills that are being assessed. It's not just a random thing. Every skill is being assessed. So I'll just go through these quickly and like tell, this will give you an idea that what are the points on which you are being assessed on the exam, right? It's not just your knowledge. This is one thing that I tell everyone, especially those who probably have given some ND exams, some FCPS exam in their own local areas, because in those exams, theory is the main part. They want to tell like a lot of management till the very end. But this is the exam in which it's not just about your knowledge. It's about your communication. It's about your skills of dealing with the patient, and the way you are able to communicate your information rather than how much you know, right? So they want you to be a safe doctor. This is not a consultant level exam. This is an ST3 registrar level exam in which they want to know that you're a safe doctor. You are able to identify the emergency points. You are able to identify, you are able to make good diagnosis, and you are able to plan a management. The management is done with the multidisciplinary team. You are not going to do everything on your own, right? So these are the things that you have to keep in your mind. So I tell those who have like already given exams to step back a little and unlearn certain things for this exam, because you are in a habit of treating the patients and going towards the dosages and everything. That's not required for this exam. So we're gonna quickly go through that. What are the skills basically which are assessed in this? So this is A1 is information gathering and history taking. So how are you marked? So if you ask key relevant questions, sensitively gathers appropriate information, explores main problems and concerns of the role player in the structured manner. So if the examiner thinks that you have performed in this way, he's going to mark the meet standard. However, if he thinks that the candidate lacks some focus in exploring the relevant lines of questioning, information gathering lacks in sensitivity, and does not fully explore the problems, concerns of the role player, they're going to like give you mark in this one. So if you get mark each domain, when you see, it's of 2 marks each. So if you get like meet standard, it means it's giving you 2 marks. If it's in borderline, it's 1 mark. It below standard, it's 0, right? So this is how each station is being marked. Below standard means the questions asked are not relevant to the patient, poorly understood by the role player. Information gathering approach is insensitive or inadequate. So see, sensitivity, they have mentioned it everywhere. It's very, very important for this exam. Approach is haphazard, unstructured, does not consider or explore the problems, concerns of the role player. So this is how it goes. So you can see that from the meeting the standards to further upon, the things are going bad. So this is how They're going to mark each and every skill that is being assessed. Then the other skill is information sharing, accuracy of the information, in which you are being judged on how you explain the relevant clinically accurate information. The information provided in a well-structured manner verifies understanding or summarizes. What does this skill? So this skill is about when you are taking the history, right? And you are gathering information. This is included in your history station, in your developmental station as well. Information accuracy, information sharing accuracy of the information. This basically depends on how you summarize your case, how the findings that you have taken from the role player or the role player who is present there, and how you summarize them and tell it to the role player. Again, this occurs in the history, this occurs in your development, and this occurs in your clinicals as well. Physical examination, well-structured systemic examination technique, appropriate recognition of the requirement of care taken to adapt the needs of the patient, and permission is this is very important. Permission, exposure, all of these things are really important. Appropriate use of equipment. So this is this domain, this is assessed in the clinical stations, and it is assessed in your development station as well, because you are doing the developmental assessment in that. Then the other domain is identification of clinical signs. Like if you are examining a patient in a clinical station, are you able to identify the clinical signs that are present and correctly interpret the clinical signs? So that's what I always tell when we teach in our clinical sessions. We always tell that you need to be open-minded. You need to like look for the signs and never ever give a false finding, right? Because a lot of us, when we are giving the exams, we are in a habit of like making findings according to what differential or what diagnosis we have thought. So maybe we add something which is not present in the child. But I always tell that never tell a false finding. Whatever finding you have found in the patient, tell it and try to justify it the way you can, right? um okay, so then the here we have, yeah. So here we have D1 is the clinical reasoning, which means that the candidate formulates and proposes likely and appropriate steps if the exam is inconclusive. So all of these. So basically, this skill is depending upon. Are you guys able to hear me?
Yes, we can.
Can anyone? Okay. Okay. Thank you. Okay, so clinical reasoning is basically, it is mostly in your history station as well, in your clinical examinations when you are, you have like checked the physical examination and you have to give certain differentials to the examiner, right? So this comes in that. After that, our next skill that is management planning, because you know in each of your history, in your clinical examinations as well, you are like needed to tell the management planning. So management plans include the relevant investigations that you want to do. And then this is very important. You see, safe, ethical, effective management plan. So this does not like just require that you are telling the name of the medicines that are required. It means that you're a safe doctor. You know that what multidisciplinary team has to be involved, what specialties have to be involved, what do you like, it will involve like whatever medical personnels, then the non-medical personnel, like if there are any therapies that are required, the social worker that is required, any of the help, the social help if the parents is required, all of those things that you have to tell it in your management plan, right? Then communication skills repo. This is the core of this exam. If you want to ask me that what is the core thing that is going to get you through this exam, it is your communication. Because this communication, it is not just in your communication stations. This is marked in your clinical stations, it is marked in your history station, it is marked in your development station, it is marked in your communication stations. So this is the core basic of this exam, that you have to develop a good communication style, good repo. So what does this include? This includes that you have an appropriate level of confidence, greeting and introduction, professional, sensitive. So you see, they have this thing that you're considerate, you're empathetic towards the patients. Appropriate body language, which means that you're not shaky, you are not stammering, you are not using a lot of your hands. Then you are responding to the verbal and non-verbal cues. What does this mean? That if you're in a communication with a role player and the role player starts crying, so you are not just talking that, you are considering that the patient, the role player is upset, and you stop at that point and you console them with your words, with any of your actions, right? So this is all of the things are being like marked. Then develops appropriate rapport with the role player, puts the role player at ease, clarifies role and shared agenda, appropriate tone and pace. So all of these things are dependent. So obviously, when you get guidance, when you join courses, the people who guide you, they're going to tell you that how to do all of these things, right? Then the other skill is verbal and listening communication skill. This means that in the history station, in the development station, when the role player is telling you something, you are actively listening, you display interest, you allow others to opportunity to speak. Like in the communication station, you are not just speaking and speaking like I'm speaking right now. So it means that you are letting other people speak as well. Then appropriate language used in challenging circumstances with any jargon I've explained. So the jargon is basically, when you are dealing with the patients, they are laymen. They do not know our medical language. So if you use a lot of medical language words and the role player does not understand it, it's not considered very good. So basically, they want you to use simple words. Like you will not be using the word abdomen, you will use the word belly or tummy. You will not use the word ultrasound, you will use the word jelly scan. So there are books. There's a soft copy of the book of the jargon explained. You can go through that. And obviously, when you are preparing with any of the teachers, they're going to tell you with that about that as well. Then managing concerns and agreeing to the next step. It means that this is specifically for the communication stations, in which if the role player is telling you certain concerns, you seek, identify, acknowledges the address and the concerns that they are telling. You show empathy, you check knowledge and understanding, and agrees to, like, you're not just talking. Like if someone of you, the example is that if any one of you have asked any of the questions in the chat box and I just ignore that question and I'm moving forward with what I had planned in my mind, that would not be the right thing, right? So these are all the things that are being assessed upon. It's not just the knowledge that's being assessed in your exam, right? So I hope that it was clear. Any questions regarding these markings or any of those things that you want to ask? Any questions from the audience? Any confusions that you have? Okay. Okay. So then very important question of what to study for the exam. So the thing is that I cannot tell you that this is the 100% things to be done. Obviously, for an exam, there's a lot of study material. What I can guide you is a directed approach, things which are absolutely required. Obviously, every person who you take someone has opened the mic. Let me just mute everyone. Yeah. So I was saying that I'm going to tell you what is basically needed and what is absolutely necessary for the exam, without which you are unable to do that. However, the knowledge is a never-ending thing. If you feel that you want to have knowledge, if you want to have reading of certain topic in more detail, in more depth from some other point, well and good. You can go for that, right? Plus, you don't no one can journalize it for you. You have to set your own things, because if you take guidance from someone who has a lot of practice in pediatrics and he has a lot of baseline knowledge, so maybe he will tell you that, oh, you don't need to study a lot, you just need this basic things and you'll be good to go. That could be like good for him, but for you, for someone who has not a lot of experience in the pediatrics, you will have to struggle. So basically, what is absolutely necessary is this mark bt. This is, I'm going to show you picture. Let me just show you your pictures first, and then we can come to this. Yeah. Yeah. So these books that are like mentioned, this books, this past test book, this short cases, history taking, communication skills, Mark Beatty. This is an absolutely necessary book. What it has is that in the initial part, it has certain histories which are given. You can go through the histories to have an idea that what kind of histories come and what kind of questions are there. Then it has examples of some communications, which are a good thing to do for the communications. I want you guys to do the recalls a lot and obviously get the training done. What's really, really important in this book is the short cases. But in the second half of the book, they have the detailed chapters on every system, from the neuro, CVS, abdomen, like to everything. You have to read that, right? They're going to tell you the methods. They're going to tell you all the possible scenarios, cases that can come, the differentials, managements, all of this. Something which would, because you see this, the last edition of fourth edition, this is from 2016 or 17, I think. So obviously the management guidelines, they have been updated. So you need to update that and you need to read the new guidelines. But for the basic differential and basic knowledge of the diseases, it's really important that you read this book, right? Then this pediatric guidelines. Till now, we still have this 22 to 20 guidelines months. This book, you have to read this book from maybe. Is my voice clear, guys? I'm sorry, I have to ask you again because at times it comes that the connection is unstable. Are you guys able to hear me? Okay, thank you so much. Okay, so I was telling you that I cannot emphasize on the importance of this book. You have to read the guidelines from starting to the ending. How, like in which stations, if you think that, how is it going to help you in your exam preparation, in your exam in stations? This is going to help you in your history station, because the management part, the investigation part, the scenarios at times in the history that you get is like the guidelines, you have to tell them. It is very important for your video stations, because in video stations, the videos are, most of the videos which are coming have guidelines from this regarding the croup, regarding the orbital cellulitis, regarding maybe the facial nerve palsy, on a nephrotic, like whatever topic is there, right? So this is really important. Then this is going to help you in your communication stations as well, because at times there are stations in which the guidelines are required to be told. So it is going to help you in that as well. So this is a really important book that you have to done really, really well. If the new edition comes, obviously you will shift to that one. Then this next neonatal guidelines, this the new version for this for like 2025 to 28. This has been released, so it's a pretty it's a big book. Neonatal guidelines are important. They are majorly important for the communication stations, because a lot of communication topics, they come regarding the neonatology, and you have to go through this. But I wouldn't say that you have to do it like each and everything. Maybe when you get the guidance or whatever you like from a senior or someone, you can get marked that which are the important guidelines. You can find them on your own as well. How, when you are going to do the communication stations, the recalls, you're going to see that which topics from the neonatology are coming on repeatedly, and you can do the guidelines for those ones, right? So this is something you can like do partially. Then this is a really important book. I always recommend it to the students, specifically those who have not a lot of experience regarding checking the patients, making the differential diagnosis, because I personally feel that it has really good flow charts. This is for the clinical stations. It has all the schemes of the examinations of all the systems like CVS, neuro, every system, and how you there are different flow charts that if the child has this gait, how are you going to proceed further. So personally, I like this book for the clinical stations. Other than that, so we've already discussed that you have to do mark bt guidelines, clinical secrets. Then there are notes. So a lot of like Google Drive links are being shared. I'm not going to take name of any of the notes. There are plenty of notes outside, like which are available. What I want you like is to explore your options when you're starting your study. See if you feel comfortable with any of the notes and you think they are really well written. You can obviously adopt things from them. You can learn things from them. It's up to you, right? But it basically totally depends on your own choice. Obviously, I would not recommend any of the notes. It's totally up to you, but obviously you can explore. But do not blindly follow anyone or anything. Obviously, when you see one or two or three things, and then after that realize that which one is like suits best with your style, and which are going to be really important, or which are going to be helpful for you. Other than that, I would like really ask you to like make your own notes. This notes you can, if you have joined any of the courses, then it's really good for you. Whatever the classes are giving, make your own notes. If you are a friends or group of friends, you're studying together, then make your own notes, because when you write things on your own and you learn from, if there are any free sessions that are going on, a lot of data, like if you see our groups on, we have like free WhatsApp groups, and one of our colleagues, she regularly posts things there. Then we have free sessions going on every week as well. So if you're joining that, uh, whatever you are learning from any place, make your own notes that are really, really helpful for you. Then online is that, so you see, the thing is that in the guidelines that I told you, pediatric guidelines, it has a lot of guidelines, but then there are topics which come outside of these as well. Like suppose if I give you example of eczema herpeticum, it is a very, very important topic for the exam, but it does not practically has guidelines in this pediatric. But the website has every guidelines. Whatever topic you think is coming and it is not in your book, you can write it on the Google, the name of the topic and the NHS guidelines, and you will get the guidelines for that. Dr. Hafiz is saying patient info common, so much confused how to cover. Can you please clear that? What exact is your question, so that I can answer you
Madam,
properly? Yes, yes.
yeah, I have to ask about the patient info notes. So there are
Yes.
a lot of patient info. So how we should cover them?
So the thing is that you do not have to go for each and everything. You see, if you have someone that you are like have joined a course or something, you can obviously discuss it with your mentor. If you are preparing on your own, then you can go through that, and whatever topic, when like I would suggest you to start going through the recalls, and in the recalls, whichever topic you see is not really making sense to you, and you want to maybe learn more about it, you can download any of the patient info site. What patient info gives you is that it gives you the information in very simple way. Like for suppose if I tell you that about the H pylori, so at times it's really difficult to answer the concerns of the parents and explain to them that what is H pylori, how does it affect you, how it is treated. So you being a doctor, we are not very used to that. If you're not working in the clinical setups or in UK in which you are interacting with the patient in such a way that you are communicating a lot, so it might get difficult for you to use proper language and proper words to explain a certain disease. So that's where the patient info comes in. They tell you how to tell a certain disease in a certain way. Like in H. pylori, they are going to tell you that this is your tummy, this is the lining of the tummy, it has acid in it, and this acid is this protective layer is covering the stomach from the acid. But if the bug is being affected, it is going to thin that layer. So this is just an example that I'm telling you. So that's where the patient info comes in. Once you start reading patient info for the initial topics, maybe after that, when you have got the hang of how to communicate and how to explain the things in a simpler way, you will be able to do that on your own as well. Okay. Okay, so that's another source. Other than that, if you think that any of the guidelines which are not available, definitely look, just write on the Google, like the topic and the right NHS guidelines, and you'll be able to do that. Then, what I cannot emphasize enough is past paper recalls. Very, very, very important. You guys are given the written exams. You know, there's a lot of repetition. You know, there's a lot of things that are coming on, and the recalls are very important. They are very important for the clinical exams as well. It's not that exactly those things are coming on. Obviously there's variation in the clinical exam, there are a lot of variation coming in, but at least for your practice, you need to know that what trend has been going on. Like if I give you an example, of like a year or two, like a few years back, the histories that were usually coming were more of the chronic diseases like diabetes, cystic fibrosis. Those were more in trend. Recently, if you look at the recalls, the histories that are coming are more open-ended, like management of the constipation, like a UTI case, like just a respiratory, like viral induced wheeze was like it was a history in one of the stations. So now the trend, so by doing the recalls, you get to know that what trend is coming on. Then you need to do the recalls of your station specifically as well. Your station means your the area where you're applying. Like if you're applying in UK, you definitely have to go through the communications which are coming in UK, because you see in the UK a lot of ethical scenarios come in. That's really important. Then you need to know the patient pool of your area as well. Like if you're giving exam in UK, you need to know that what kind of patients are coming in UK. If you're giving exam in Pakistan, you need to know that what kind of pool is coming on there, right? So obviously you have to prepare all of your own, but recalls are really, really important for everything. The most thing that gets repeated here is the video stations. Like there's a pool of maybe 40 to 50 videos, and they are repeated the most. The communications are definitely varied, the history is varied, development is repeated again and again, because you see development has a limited portion. They're only for like fine motor, like gross motor, fine motor, then social and hearing. So that's a limited number of things, so that's why they're repeated again and again. Otherwise there's a lot of variety, but you need to know about your station well before you go and attempt for your so Dr. Hafiz is saying kindly share the Pakistan pool if possible. I think a lot of recalls are being shared. There are a lot of Google Drive links. We'll share the Google Drive links again in our groups. You can follow for that. You can find the recalls in that one. Okay. How much time is required for the exam preparation? Another very important question that you guys have. There's no fixed time. It depends on a lot of factors. It depends on how much time you have like uh, uh like practice, or you have worked in the pediatrics. How much experience do you have? How much base knowledge do you have you given any other exam before or not? But roughly I would say 6 months is a mean time, right? It could be more or less depending upon this, but 6 months is a mean time. Depending upon that, in the initial months, you would just start looking at the stuff. You will just start having in the first 1 to 2 months, you just have an idea of how the exam goes. You just like familiarize yourself to the things and all of that, and then but in the next 2 months you study all of the things, and in the last 2 months you kind of really put your all your effort and practice and practice and practice, right? So roughly I would say 3 to 6 months is an average time. I have candidates, I have colleagues who have like done preparation in 3 months, who have given it, but it's around like 6 months is a general. However, if you are someone who is like is at a very beginner level, who does not have a lot of background or the baseline knowledge, then it might take you more than 6 months to maybe a year as well. But that's fine. That's your own pace. No one is going to judge you. It's an expensive exam. It shouldn't be something that you should give in a rush. You should take your time as much as you want, and when you are very sure that you have a good practice, only then go for it, right? So that's plus obviously if you're preparing with someone, you have any mentors with you, and they're guiding you, so they can guide you as well, that if you're ready for exam or not, right? So that's a journal timeline. Some tips that I want you give for your exam preparation: get proper guidance, right? I cannot like tell you that how important this is. This is not an exam, and I tell you again and again, this is not an exam in which you will just open a book, you will go through whole the book, and you will pass the exam. This is not one of those exams. And because this is not about what you know, as I already told you, it's about how you do it, what's is coming, what the examiner is expecting. So you need proper guidance. This guidance again should be from the very start, when you have started to like thinking of giving the exam, because one, you have started practicing with the wrong guidance or without practice, it's difficult. You'll make your habits, and then it will be difficult for them to change. You can obviously guidance from any of the seniors, if you have any of the colleagues, friends, if you have around. If not, then obviously there are a lot of the courses we offer. We give you one-to-one guidance in each and every step, so you can obviously contact us as well. So guidance is really, really important at every step, right? So you really need to go for that. Then divide your days for different stations. So obviously when you have make a schedule, obviously whenever you make a schedule maybe for a month, and like maybe in the initial months you practice for maybe 2 times in a week, that would be okay. and gradually you start like doing increasing the days of the practice. Practice communication daily. Communication, as I'd already told you, is the key for this examination, right? So if you ask me that from where to start the preparation for this exam, I would say start practicing communication, start listening to communication, start doing it. um like the more you do the communication, the more you are able to be like, you have the chances, the high the chances you have for passing, right? So this is my like, do communication at least 5 times a week. That's really, really important. If you're not practicing it with someone else, then record your own voice and listen to your own self. That's a very important thing to do, because when we speak, we do not know that what ahs and oohs and what breaks are we giving. So record yourself, listen to yourself, and then improve yourself, right? Then development is something that I usually recommend that we should do by the end. In the initially, I recommend that start the communication, history, and clinical methods. Development in videos is something that you can do by like maybe by the mid of the preparation, right? One history per week is a good option to do. Practice clinical methods. So you see now the exam is like we have face-to-face exams. So the clinical station, it's not just about knowing the things, knowing the differentials. It's about how you touch the patient, how you find. So unless if you have like if you have access to going to the hospitals and seeing the patients with the findings, well and good. The best thing that you can do is go and touch the patient. If not, then at least practice the methods on the healthy persons who are around you, because if until and unless your methods are really up to the mark and really good, you will not be able to pick the findings, right? And for the findings, you can see different pictures, you can see different videos of the patients with different diseases, right? Revising the developmental charts, very important. We are not very used to doing the development, and that's one of our weaker points. I always say in the initial phase of the preparation, development station seems to be the most overwhelming and most difficult station, but once you have mastered it, I believe it's the easiest one to score, and that's for the 12 marks. So if you do that well and you score 12 marks, you have a lot of leverage to maybe mistake like do mistake in any of the other stations, right? So there are different developmental charts. They are at the back of the mark BT as well. They are on the RCPCH websites as well. And again, the notes that have been circulating around the charts are there as well. Exam day preparation. A little bit about the exam day preparation. Obviously, that's the day is gonna come for each one of you. So basically, you have to be very comfortable in your clothes. You only take your stats with you. You do not take any measuring tape, any watch, any torches, anything with you. All of the things are present in the rooms. You can like ask for them and you can use them. Ideally, it is recommended that you do not wear like full sleeves. Your arms from the elbows to the hands, it should be empty. There should be no watch, no bangles, nothing, because of the hygiene issue, because of the cleanliness issue. But if but for the reasons of modesty, you want to like cover full sleeves, that's fine as well. Overall is not recommended. You just wear your trousers, shirt, whatever is comfortable with you. But do not like if you wear a hijab or if you wear a dupatta or something, then tie it very properly. It shouldn't be coming onto the patient. You should be confident. You should be able to communicate well. You should be in your full energy on your exam day, right? Obviously, when you ask like further, when we train the students, we train them how to sit in the exam, how to communicate, how to like start the mannerism, everything. That's is like that comes with the practice as well. A lot of you see there's a failure rate as well. So obviously people want to know that why students fail commonly. What I would say is that obviously you cannot just like generalize it. There are multiple factors. One thing obviously is that you have not practiced enough and your skills are not up to the mark. But one of the other reasons that I commonly see is that people they tend to not understand the root or the main essence of this exam. They tend to focus more on the studies and just learn more and more and more the theory part and focus less on the practice. I think that's the most common reason that I feel. This is one of the exams in which you need to start practicing and speaking from the day one. We teach it in our course. We like the person who is joining for the very first time, we try to make them speak even if they don't know anything. Because if you think that okay, I'm just listening to and I'm learning passively and I'll be able to reciprocate that in the exam, that is less likely to happen. So the most important reason I would say is that not coming up and not practicing enough, because if you have not practiced enough, then you will not be able to practice well in, like, perform well in the exam as well. Another common reason is not having a broader vision. Because you see, in certain areas of the exams, there are limited number of patients that are coming. Your differential, your like diagnosis, they are very limited, and you think that okay, only this thing can happen. But the RCPCH, it brings variety of patients, variety of findings, and you need to be open ended. It could be anything. You need to have a good preparation, and then you need to be open ended, that it could be like anything. Like if I give you a simple example, that there have been examples in which the command was given on a child that you have to do the respiratory examination, and the respiratory examination was totally normal. You wouldn't expect it in any other exam, right? You would think that there would be some crepitations, there would be some decreased air entry or something like that. So that happened with one of my friends. So she said it that the respiratory examination is totally fine, and it was actually the same, actually the case. So after that, the examiner said that this child has the problem of having snoring at night. So basically, they took her viva on obstructive sleep apnea, right? So you need to be open minded and aware that this exam, anything could happen, right? So that comes with a lot of practice. So practice in speaking, practice in doing methods, and doing the right approach, doing the practice with the right people. If you are doing practice with one or two of your friends who are at your level and who are unable to identify your problems, then I think that practice does not really matter, because you all are in the same circle and you are unable to point out the mistakes, right? So you need, as I told you earlier, you need a guidance, you need a mentor to tell you that what is right and what is wrong, right? So, any questions up till now regarding the exam, regarding anything? Further, I'm going to tell you that how we do the teaching and how we do the courses at MedPrep, and we'll have a brief discussion about that. So, any questions, any queries that you guys have? Okay, you can post it in the chat box and I can respond to that. So let me introduce you to our clinical mentors. MedPrep is like in the teaching for the last almost 3 years now. And currently we are three mentors in the clinical badges. Dr. Madiha Sarwat, she is also a senior registrar. She is a developmental pediatrician as well. And she's also working at University of Child Health Sciences. Dr. Nadeem Iqbal is a pediatrician and he is a neonatologist and he's working in Ireland. And me, I'm Dr. Iqra Ahmad. I told you that I am working as a senior registrar as well. So our new course that is starting is basically starting for the exams from the 1st August. You can definitely, we have these numbers here. You can contact us here and you can join. The few features of our course that I want you guys to tell is that we have live sessions. You might find a few courses in which they just give you the recordings, but here at MedPrep, we believe in interacting with the students. So we have all the live sessions. We have for a WhatsApp group in which you can always ask your things. The recording of live sessions, certain people just give you the recording sessions for 3 or 5 days. But in like here, you will get the recordings till you pass your exam. You have access to your account and all the live sessions. Obviously then we continuously give you tips and feedbacks, one-to-one feedbacks. We are as mentors, we are open that you can contact us personally as well. You can send us your voice notes and we can judge you on that. We cover all the prep stations like history, clinical, communication, development, video stations. Our mentors, as I told you, we have all have experience of like maybe around 10 years in pediatrics. Then we every station is not just it's not the teaching stations, just it is the practice station. Every station is a practice station, so you start practicing from the very beginning, and by the end we have one-to-one mock exams for the candidates as well, which really refines you and it tells you the how the exam goes on, right? So we also include all the recalls in our classes as well, so that's how the things goes. So this is our success story for all of you. Maybe you have following our groups. This result just came yesterday, and these are all the students who passed. We taught all of them and they have passed from the UK center. So if you think that maybe if we are like not, if like someone has concerns that we are not like um teaching up to the mark to the levels of all of these, Dr. Charu, Dr. Anam, Dr. Nagam, all of these, like you're saying, they passed from the UK exam, right? And most of from all the candidates who pass in the Nepal station as well, from the Singapore station as well. Um, yeah, someone has messaged. Yeah. Okay. Am I not audible? Can anyone message? Dr. Safura is saying there is no audio. You cannot hear me? Okay.
Yes, you are audible.
Okay, so we had a very good candidates, Dr. Tanushri, Dr. Susan, like a lot of these are from the all the places. Like from there were exams in the Singapore center, there were exams in the Nepal center, Sri Lanka center, like recently Sri Lankan center was I think it was the first center recently. So all of these were the candidates who gave exams, then more candidates from different stations as well. So, so you see, you can see here that one of our candidates, she was a really good candidate. She said she got full marks in development and history. So you see that why are we telling it to you? Obviously, as I told you that this exam needs guidance. And I told you that this is a really, really expensive exam. So you wouldn't want yourself to just jump into this exam without the right guidance, right? So obviously that's your choice. And you can definitely contact our team. The numbers are given below. And the fee structure, you can message on these numbers. I'm gonna share the numbers. Oh yeah, this okay, I'll just zoom in the number. If the admin team, you can write the number in the chat as well. So you can contact on the given number, and you can get all the fee structure details on that as well. Someone has asked that, can you arrange a feedback session from the recently passed out candidates? We can do that, but personally, I don't prefer that because a lot of candidates are not comfortable with that because that gets very exposed to that. So maybe if you are really interested, we do have like feedback with the smaller group of people like our candidates. If you are someone who really wants to have a feedback listen, you can contact our team on the given number, and maybe we can share the feedback thing with you and you can listen to that. Because a lot of candidates, they have issues with like if they tell the exam something might happen, so some are really hesitant. So that's why we do not do the open feedback sessions, right? So this was all from my side, and I hope that this session cleared a lot of your confusions, a lot of questions that you had in your mind regarding the preparation. I'm welcome. I'll be more than happy that if you guys ask me and load me with questions, anything that you think has not been covered and you want. Um, uh, I really want, like, I'll encourage all of you to join our WhatsApp groups because there's a really like daily activity going on there, and you can learn from that. And do join our free sessions as well. They're really helpful as well. And yeah, so our team has shared the numbers. You can like check the numbers from there. And any questions, anyone, any comments, please, because I know you have spent 1 hour of your very precious time on a weekend to listen to my voice. So if you have any comments, anything that you want to say, anything, I would be helpful. Like I would be like really happy to help you guys.
Hello.
Oh, yes. How are you?
Yes, I just want to ask, I'm fine. How are you too?
Yeah, thank you.
Yeah, I just want to ask how many of the stations will have real patients
Okay, you have real
as opposed to
patients on.
watching, yeah.
Yes. Okay, so I'll tell you, the real patients are on 4 stations, the 4 clinical stations: clinical 1, clinical 2, clinical 3, clinical 4. In these one, there's always a patient of CVS. There's almost always a patient of abdomen. There's a patient of neurology as well. And then on one station, they could be changing the station. It could be MSK, GP, or something like that. Plus, the patient is not same for all the 12 candidates. They've changed the patient very frequently after like maybe every 2 to 3 candidates. So yeah, so on these 4 stations, you have real patients. On history, on development, so the history goes on like that. You take history from the examiner, sorry, from the role player for 13 minutes. And then you like give all your answer and question session is done with the examiner. In the development station, you take history from the role player and you do the assessment part with the examiner. In the communication stations, again, you have the role players. Role players are really, really well trained. I mean, you will be amazed at how well the role players act. They cry, they shout, they shiver, they are really good actors. And on the video stations, there's no one. There's just a laptop on which you are seeing a video and you are hearing the audio and you give the answers to the examiner. So practically, patients are on 4 stations. Okay, so we have new messages. Yeah, so someone is asking that when will be your next clinical batch starting? Yeah, so our batch is starting from, we already have our batch started on. You can join us right now. We have started started a few classes. So the officially it's starting on the 1st of the August. So you can start. It will be for 6 months. A few sessions which have already gone, you can get the recordings of that. And from now on, from the 1st August forward, you will be joining all the live classes till you pass the exam, and all the recordings will be there for you, right? So you can get in touch with our team to get the answers. Dr. Farida, thank you so much for appreciating the session. I hope that it cleared your queries. Do we have to need the examination tool? No, you do not take any examination tools with you. You just take your stethoscope. You do not even take a toy or a candy. That's really not allowed. Any other thing that is required, starting from the watch to the torch to measuring tape to the hammer, anything that is required is present on the table at that in the room. If you are unable to find, because you know in the exam you are unable to see that, oh, where is those things, like in the neurology you want a hammer and you are unable to locate it, you can simply ask the examiner that I want the hammer, and they're going to guide you towards that, right? Dr. Vijay is asking that, does role player know English, madam, in all countries, or will we have to translate it? Okay, the thing is that the role players in the history, in the development, in the communication station, both. So these 4 stations, the role players will communicate with you in English because they are not the real patients. They are the actors who have been taught how to behave. So that's all in English. The stations in the clinical, obviously, if you are if you're given exam in your native set country, so the patients would be coming would might not be knowing English. But the thing is, like, if I give you example, if someone of you, if you're from maybe India and you want, so there will be a patient who only speaks Hindi. So you can just tell them in Urdu or the Hindi to के like आप लेट जाएं, अब मैं आपका ये चेक करने लगा हूँ, like just for example, right? That's the only communication that you need to do. So if I give you example that I gave exam in Pakistan, and my examiner was a British. So when I was giving commands to the child to maybe just walk or do something, the examiner asked me that, what are you telling? So I just tell her that I asked the patient to lie down, sit down. So that's really not a problem. Even if you don't know the language of the patient in the clinical station, you can just tell them by your hands or by anything that you need to lie down, because there's not a lot of communication going on there, right? Rest all the exam is in the English. Thank you so much, Dr. Maria, for appreciating the session. Thank you so much for your time, for joining in and being active. Dr. Farida is asking, shall we be just examining and the examiner watching us, or keep telling the findings? Okay, that depends on person to person. There are a few people who really have a habit of just narrating everything when they are doing the examination. It makes them at ease, but that's not required. And that's not something that we prefer. We prefer that we prefer that you communicate with the child, with the patient, in a way that is required. Like you maybe ask questions from him, put them at ease, ask him that if he's comfortable. So you put your effort in that, in communication, in communicating with the patient, rather than explaining the findings and narrating all of your steps to the examiner, right? So that's not really recommended a lot. But if you're someone who really has a habit, you can like maybe do it once in a while in the examination. Thank you, Dr. Vijay. Dr. Maria is asking, is UK role player more trained than the other country? And is it difficult for IMG to communicate? Um, Yeah, they're trained well, because obviously in those stations they the role players are coming again and again, and they're really well trained. For the communication, there could be an issue with the accent, because they have different accents. So if you're someone who has like a very typical Desi accent and you don't understand, that could be an issue. But that's not something that is going to cause a lot of hindrance, because you see a lot of our candidates right now, the picture that I showed you, they were not all the British people. They were people from India, Pakistan, who were residing and working in UK, and they did give exam in UK and they passed well. So it's just a little bit practice that's going to get you through it, but it's not something that's going to cause a lot of hurdle in your passing the exam, right? Okay, thank you so much, Dr. Farida, for joining in. Any more questions, anyone? The chat box is still open. We can thank you, Dr. Omo Balaji, for joining in. I hope it was helpful for all of you. This will be available on the YouTube as well, so you can share it with your friends. Thank you, Dr. Zahid, Dr. Safura. I know it's really difficult to get an hour or so on the weekends and listen to this, but I hope it was helpful. If you have any further questions, any queries, you can always message our team members. You can always message on our groups as well, and we can respond to you. And best of luck every one of you who is preparing for the clinicals, who plan to appear in the clinicals. Lots and lots of wishes for all of you guys. And if there are no more questions, then I'll be just signing out and wishing you all of you a very nice day ahead, right? Thank you so much, guys, for joining in. Have a very good day. Bye-bye.